My dear friends, you are with Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. And if you're following me, or even if you're not, I have to tell you that I decided I needed to do 3 programs to discuss cancer. What do I mean by discussing cancer? What I mean is understand cancer. I want you to help you to understand what is this disease. It's a word that's in everybody's mouth. It's something that we all fear. It's something that we know could be deadly. So it's a very important subject. And many of us have heard about somebody in our family, in our friends, in the news with some celebrities, that they have cancer. And you say, okay, that's a terrible disease, but what exactly it is? So I decided I have to do a series of programs understanding cancer for you to have a better grab and understanding of what cancer is. Because the more you know, the better off you are, the better equipped you are to face it, to prevent it, to solve the problem. Because yes, you can solve it. That's the most important message here. Yes, you can prevent it. And I'm not saying that. This is from the Center for Disease Control in Atlanta. They say you can prevent it. And there are simple things to prevent cancer. So there are many things that you should know because it is so important to understand it. So we don't have to face it, but if we do, we have to know how we are going to face that challenge and how we can come successful out of that battle, because a battle will be. Well, I decided to do 3 programs about understanding cancer, what it is, how it develops, how it can give you all the problems, etc., etc. So I have that series that you can watch through these same media, through my podcasts, to see understanding cancer, understanding why, understanding strategies, understanding all these things. But then I felt I was short. So I decided to turn it into a 5-program, 5 podcast series. So today you're going to watch the 4th. And I'm going to tell you why I decided to do the 4th. Because I'm trying to give you not only the understanding, but I want you to have the tools to know what really works in our fight with cancer. Let me tell you, mortality rate in cancer has really dropped down in the last decades. The problem is we have more cancer than before, but percentage-wise, mortality rates are coming down. So we have 2 problems. The first problem is when we talked about prevention, and I would absolutely encourage you to watch that program with your family, with the people you love, with your co-workers, etc., and say, let's take a look at this, because you can prevent it. But the problem is that we're seeing more and more cancer. And even though mortality rates are coming down, the number of people affected by cancer is growing, and for the same reason we see more and more news about cancer. And yes, many of them are going to die. Now, why is it that mortality rate is coming down? For one simple reason. Well, I wouldn't say one, but I would say the most important factor. The most important factor is early detection. When people have cancer, in more than half the cases, they go to the doctor when symptoms developed. And when that happens, you might be beyond the optimal situation to face in a very successful way cancer. You might still be successful, but your chances are going to diminish. So it's very important that you know you are developing or you have a cancer before even symptoms set down. You say, well, how am I going to face storm if I don't even know when it's coming? Well, I have two words for that: surveillance and vigilance. If we become a lot more vigilant of our own body, if we become smarter in how we deal with our own body, we're going to be preventing in the first place. But most importantly, if worse comes to worse and we develop a cancer, we will be able to tell early on the development of the disease. When therapies are more successful, less expensive, and suffering is way down. So there are many things we can do to succeed. And the problem with cancer is that many of the symptoms are truly nonchalant. There's nothing that you can say, well, I have a headache, I must have a brain cancer. I have a chest pain, I must have a lung cancer. It's nothing like that. Symptoms are very non-specific. And I'm going to give you a few clues. Weight loss. Weight loss is a very important clue. If all of a sudden you start losing weight for no reason, and even if you have a reason, you have to see how much weight are you losing. Watch out. I have a patient who was overweight, had done many diets. You know the story, some of them successful, some of them not very successful. The fact is that she started a diet. And when she started the diet, then she started all of a sudden being very successful. She was losing weight very well. And that prompted her idea. She immediately went to the doctor and she said, "Doctor, I'm losing weight." And the doctor told her, "Are you doing anything to lose weight?" She says, "Yes, I'm on a diet." Well, that explains the weight loss. She said, "No way. I know how I suffer to lose weight. I know how difficult it is for me. And this time, everything is going very successful. And I think that I'm losing a lot more weight than my intention is. So something is wrong." Because of her insistence, not the doctor, because of her insistence, she went on a number of tests. And sure enough, they discovered a tumor in the back of her abdomen. Okay? It was a lymphoma way in the back of the abdomen, close to the spine. The tumor was removed. She went on therapy. She went on immune enhancement. She went on a lot of good things. And you know what? She survived. Has she just thought, well, I'm losing weight because I'm good with this diet, she might be dead today. So that is what I mean by vigilance. That you not only take a look at what's happened in your body, but you look at the whole thing. She knew she was on a diet, but she considered she was losing too easy, too fast. Something was wrong. Another important clue: blood. Blood is a bad sign. That's why it terrifies us every time we see blood. So if you see blood anywhere, watch it. That could be cancer, particularly if you are, let's say, over 40, 50 years old. So if you see some blood in the stool, some blood in the urine, you cough up some blood, you see any sort of bleeding, you see black and blue marks for no reason, which means bleeding under skin and so on, watch it. I'm going to give you very important advice. Every time you go to the toilet, don't flush. Look. You remember that French nobility used to have people that took the basins to be watched by the doctors. It is very important that we look. You go and pee, you watch what you urinated. If it's too dark, too yellow, too different color, and the more you do it, you're going to learn to watch what your normal urine should be like. Same with stool. And if you see any mark of blood, that could be the key. Furthermore, you do not necessarily have to see the blood. They're very simple tests that will tell you if red blood cells appear in your urine or in your stool. They're so simple, so inexpensive, that you could do them every 6 months, once a year, as part of a normal checkup. Believe me, you're going to be spending pennies on that evaluation. But you will be able to tell if you're developing a bladder cancer or a colonic cancer very early on. And at the first sign of alarm, then you can go to the doctor and then you can proceed for further testing. What I'm telling you, and that's the entire importance of my message, that unless you take action, unless you become proactive, unless you start your own vigilance plan, things might get very, very complicated in the future. You have to do it. You have to watch yourself. You have to see what's happening. And nowadays that laboratories are so easy to do and so easy to check, well, I'm going to check for blood in my stool, I'm going to check for blood in my urine, because I can detect it way before I can see any redness. When you see redness in your urine, that might be complicated already. But if you do this every 6 months, I mean, you pee anyway, put it in a little bottle, bring it to the lab or go to the lab and pee in the lab and check it out. Same with stool. You know what? That might save your life. So share this video with everybody, with anybody that you love, and we'll continue talking about that. I am Dr. Rodrigo Rodriguez, and I'm Medical Director of BioCare Hospital, and I'm with you in this, my 4th of 5 programs, Understanding Cancer. As I told you before, and I've told you in all those videos, all those podcasts that you can follow if you just follow the links, I'm trying to give you information about cancer. But not just raw data, not just statistic figures. I'm trying to help you understand, help me to understand what is cancer and how we can beat this complicated, expensive, and many times deadly disease. And when you look at the history of cancer therapy, you see that the big advancements with cancer have really been the fruit of early detection. That has made a big difference. Cervical cancer, for example, was very deadly, huge killer, until somebody discovered that you could check it out way before the cancer developed through a pap smear. What is a pap smear? Well, cervical cancer grows in the lining of the cervix of the uterus. And it is as easy as to just take a smear from those cells, look at them under the microscope, and find out if all of them are normal or if we have cells that are not normal. All you have to do is take smear. You don't need anesthetics, you don't need medication, you don't need anything. All you have to do is go to the doctor, take this sample, and the laboratory will do the rest. So from your perspective, it's going to be very easy. What happens when you do a pap smear? When you do a pap smear, you can see, and that's a real blessing, you can see not necessarily cancer cells. This is very important for you to understand. You can see cells that are misbehaving, going to be cancer cells. They're not cancer, but they will be. And the pathologist at the laboratory is going to tell you these cells are not normal, but they're not cancer either. That's a win-win situation. You can tell something is not right, but you know it's not a problem. So what you can do? You can remove them, you can treat them, and many times they're so small, they're so little, that you can literally take them out. And you forget about the problem. Many cases, they are produced because of inflammatory or processes in the vagina or the cervix that when treated can come back to normal. But it is so harmless, so simple, and really inexpensive to do it that you can do it every so often. And actually you should do it every so often. And that's the pap smear. And you know about it, and you do it regularly, and you plan it. Many physicians and researchers say you should plan it on your birthday or around your birthday, so you do not forget about it. Because forgetting about it might be very costly. So about once a year, when your birthday comes, you can do a pap smear. And that will be a life-saving. Cervical cancer is one of the very, very few cancers where you can say, congratulations, you are cured. Because when those cells are removed, the cancer will not develop, ever. That's a real blessing that we all should take care of. And it's so important that it dropped dramatically, but dramatically, the death rate of cervical cancer just by doing an early detection procedure, just by being vigilant, just by being proactive, just by being with a great surveillance strategy that can let me know that something is going in the wrong direction and I can take it out, get rid of it, and be healthy again. That's really probably the best case scenario. But you have to go. Once again, just as I was telling you before, you have to be proactive. You have to do about it. You have to think about it. Because you're not going to feel anything. You don't have any symptoms. You're not going to see anything until it's too late. By the time you develop symptoms in cervical cancer, your chances are going to be very, very slim. So don't let it happen. Don't let it happen to your mother. Don't let it happen to your friends. Don't let it happen to anybody. Just get together and say, have you done your pap smear? I know this is very important. That's early detection at its best. Not only because you can tell, but also because you can cure. So we have to do it. Next thing I'm going to talk about is breast cancer. Because breast cancer is becoming more and more common. It has actually displaced lung cancer in terms of frequency. And breast cancer, we all are afraid of it. I mean, women probably think of it every day, and I hope they think of it every day. Breast cancer, once again, can be treated successfully. And actually, death rate for breast cancer is dropping. The problem, once again, is that we see more and more cases. So on one hand, we're winning some of the battle because our death rate is becoming lower, but the number of cases that we have are a lot more. And we have a podcast about it, about why cancer is increasing. Not in this series, but we have separate. So we have to see, well, what am I going to do with breast cancer? And you know the answer. I don't have to tell you. The first tool is self-examination. And you have to start feeling your breast. You have to start knowing how your breast is. You have to teach your daughters. If you're a mother, you have to tell your daughters how you do it. Even if they're young, even if you're not afraid of breast cancer at all, you have to show them how to do it. Because in the future, you might not be with them. But they already know. They have to know how to explore themselves. There are many tutorials about it. You can go to the web and learn. And once you learn how to do it, you do it regularly, once a week, twice a week. And that creates a very clear image in your fingers, in your brain, on how your breasts are. You're going to find out what every nick and part of it works and where it's a little bit harder, where it's a little bit something. So you're going to be able to tell if you discover anything that shouldn't be there. Breast cancers, in most of the cases, are going to initiate as a growth within your breast. A lump, as we say. The smaller the lump, the more successful you are. Because you know what? Cancers begin in a very tiny area, we said, by creating an internal uprising of a group of cells that it starts growing faster with very low death rate. So that creates an overpopulation of cancer cells that, of course, will have no place to accommodate and will create a lump. Don't wait till you have a real big lump. It should be under 1 centimeter, under half an inch. That should be the maximum, where you can feel it, where you can detect it. Mammograms can tell you if is something there, but remember they're not foolproof. And remember that before 50 years old, they're not very accurate. We have a new tool, and also I want to tell you about it for early detection. You can do a PET scan. You probably have heard of PET scan for cancer detection. Well, this is a substance that's taken by cells that are metabolically active. And cancers are very metabolically active. So they take this substance, and when you do the PET scan, you can see it. Now, you don't do just a regular PET scan because those are machines designed to watch your whole body. No, you have to go to a high-resolution breast PET scanning unit. If you look around the cities where you live, you might be able to find one very soon. or even go somewhere else. They're going to become more and more common. But remember this, you need a high definition breast PET scanning. And that will tell you that little thing you feel in your breast is metabolically active. Because many times you go for an ultrasound or you go for a mammogram, they tell you have a lump. I know I have a lump, I can feel it. But what is it? Only cancer will turn positive to a PET scan. A cyst or anything like that will be silent to that. So there you have a lot of information. Not only that, but it will also tell you if there is activity in the lymph nodes or anywhere else in your breast. And then you're ready, you're equipped to face it very early. And you know, if you catch it like in a quarter of an inch, just removing it will cure you, just as we were saying of cervical cancer. Give yourself a chance. Listen to these words, follow me, and if any questions, call me. I'll be very happy to help you. I'm Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital, and I'm delighted to be with you. I'm delighted to deliver this message that to me it's very important. That's going to transfer a good part of the responsibility of beating cancer to you. Not to your doctors, not to your hospitals, to you. Because I have said that beating cancer, if worse comes to worse and you develop a cancer, you have to catch it early on. The earlier, the better. That the big advances against cancer have been produced by early diagnosis, by finding out soon that we have a problem, so we can act upon it. We have discussed different types of cancers and strategies to find out very early. But nothing is going to happen if you are not aware, if you're not proactive. I don't say that you live with fear. Quite the contrary. You should be very optimistic because you say, I'm watching you. And I'm going to find out what happens. Because I have said the problem with cancer is that many times, probably 60% of cancers are detected once important symptoms occur. And when that happens, we have passed the best opportunity for successful treatment. If cancer spreads, we have said it becomes a lot more deadly. 90% of cancer deaths occur when cancer spreads, not before. So we have to be aware of it. We have to know, and we have to be fearful in the right way. I mean, yeah, I'm afraid of cancer. That's why I'm watching it. That's why I want to do simple things to watch it. And the first rule of thumb is, again, see how I work, see how I function, what happens. See if I lose weight, see if I have blood anywhere, see if I don't feel well. That's very frequent with cancers. All of a sudden, we get up one day, and we don't feel the way we felt before. Our energy, our stamina is not what it used to be. And you go to the doctor, and this is something you have to be very watchful, because I've seen it over and over and over again. I have more than 50 years as a doctor. You go to the doctor and you say, I don't feel well, doctor, I have lost my energy. And the doctor will tell you, well, you're now 50, now you're 60. What did you expect? Watch it. You have to insist. you have to say, doctor, I want to be tested. I want to be checked. Because I want to know if there's not anything wrong. Okay? So forget about the idea that it's all on your head. Forget about the idea that if you take a vacation, yeah, that might help. But you have to make sure that is not cancer. That is not an important disease, not necessarily cancer. So if you don't feel well all of a sudden, because, yeah, as you age, you lose a lot of things, believe me. My father used to say it's worse not to get old. But nevertheless, a lot of things will happen. But happen gradually. Like one day you see one thing, and then next month you have this, and then et cetera, et cetera. But if you all of a sudden don't feel well, if all of a sudden you are feverish, if all of a sudden you have night sweats, if all of a sudden you lose weight, if all of this, whatever, go to the doctor and insist to be reviewed, examined, and tested. And request tumor markers and things like that, because you want to make sure you're not developing a cancer. Let me tell you about a very elusive type of cancer that's becoming more and more frequent. Prostate cancer. Prostate cancer right now is the second most common cancer, and it's about the fifth cause of death of all cancers around the world. The problem with prostate cancer is that it doesn't give you many clues. There is a test that you probably know about, which is the PSA, that some people discuss whether it's really valuable or not. I would insist, yeah, that still you do it. Because an abnormal PSA could be a sign of prostate cancer. I'm not saying it's prostate cancer. I'm saying could be a sign. And it is the time to get into action. And it's when you can see your doctor, then you can do examination. Right now, same as I was telling you about the mammography with PET, the high-resolution mammogram with PET technique. You can do high-resolution computer tomography studies of the prostate that are a lot more accurate and can tell changes in there, but probably better than just a finger examination, which I would still do, particularly if your urologist has a lot of experience. Why? Because once again, early diagnosis can get you ahead of the problem. And while we're talking about that, well, let me tell you something very important. One of the best tools for prostate health are two things. Avoid bad fats, vegetable oils, margarine, that type of thing. You have olive oil, God-given olive oil. You have real butter. You have good fats to cover your needs. Anti-inflammatory fats like fish oil. Okay? That is very important. And the other one, plenty of bright colored veggies. And tomatoes are, of course, the fruit of choice. Another important fact is that tomatoes, when you cook them, are more useful. It's one of the very few foods that improve with cooking. So go ahead, have a pasta with a bolognese and enjoy it, because you might be doing yourself a favor. Just make sure they're really done with good tomatoes. Or better off, plant your own tomatoes. They grow beautifully, just about in every part of the United States. So make sure you do that. Now, let me move a little bit around the area of the bladder cancer. Why? Because bladder cancer is once again a cancer where we have the chance to beat it completely if we act early. What is the symptom that we're looking for a bladder cancer? You're not going to feel anything. You're not going to notice anything at all. All of a sudden, you have a discomfort, you go to the doctor and they'll tell you you have bladder cancer that unfortunately blah, 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 blah. Don't wait till that moment. The good thing is that a bladder cancer will manifest itself through first and very initial with bleeding. All you have to do is pee a little bit of urine at home and bring it to the lab, or go to the lab and pee in the lab. They do a little test that takes 5 seconds, $5, and they're going to tell you there is no blood in your urine. And you can do it every 6 months. That's going to be a very important tool. Because if you notice something, and immediately you go through your tomography or ultrasound, through imaging procedures, or even an endoscopy, and you detect that in fact there is a little cancer, once again you can take it out, put it in a garbage can where it belongs, and be cured. You will follow with some medication, you will follow with some procedures, but nothing really relevant. It's going to be, it is so easy and so successful that I cannot believe that we're not willing to take 5 minutes of our lives and $5 out of our lives every 6 months to check that we don't have any blood in the urine, and when you're in the laboratory, do it in stool as well. Because tiny little bleeding might be the first symptom of a cancer of the bladder or the colon. It is so easy. I have seen people that I can embrace and see and hug today because we found it on time. And I have even dear friends that are gone because they took it in a nonchalant way. Oh, it must be an infection, or must be something I ate, or must be, I'm going to take an antibiotic, and that will take care of it. You see, once again, my entire message is that we, not the doctor, has to take the position, the proactive position of finding out before anything happens. So, if you explore your breast, if you check blood in urine and stool, if you do simple things like that, you're going to be reviewing very important things that could save your life. But you are in command. You are at the helm, not the doctors. You have to go and tell the doctor, like this friend that was losing weight without any explanation, well, I want you to do something. It doesn't make me happy that I got on a diet and started losing weight very fast, very easy. I know myself, she told the doctor. I know this is not a normal weight loss. And sure enough, it was a lymphoma growing in her abdomen. But it was beginning. And the treatment was very successful. So don't let the doctor take over. Be open. Your doctor should be very open to discuss with you your options. And you can tell the doctor, doctor, I don't want to come back in, because that's what many times they tell you. Come back in 6 months and see how it is going. What if I come back in 6 months and yes, it was cancer, and I'm going to take treatment 6 months later? Stay with me. we have a lot more to tell you. I'm very happy that you are with me, Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. And I'm very happy because I think this message, if it can be spread, if it can be shared, could actually save a lot of lives. And because we're talking about early detection in cancer, how early detection has changed the outlook of cancer therapy. Because we can tell very early on when that group of uprising cells is just a tiny little thing that I can go and remove and throw in the garbage can before it has had the opportunity to change the metabolic markers of my body, to change the immune system of my body, affect any other function of my body. Before that tumor has any chance to do any wrong in my body, I can go kill it and get rid of it. That's what I'm talking about. Because it's like any uprising. If you have a group of 12 people planning something and you go and catch them and take them to justice, nothing is going to happen. But what's going to happen when you open a prison like La Bastille and you have all these people uprising everywhere? Well, you have the French Revolution. No, you have to catch all these problems very early on, because then is when you are successful. Then is when your tools are sufficient. Then is when your tools are effective. Once you have a big spread problem, you might not be able to cope with the problem. So the message here is that, yes, I know that early detection will make a big difference, but on the other hand, that early detection's responsibility is, most of it, my own. That's what I want to transfer to your hands. I'm putting it in your lap. You are the one that can make the difference, much more than your doctor. You are at the helm. You're the one that's going to demand what has to be done. You're the one that's not going to be happy with the come back in 6 months and see what happened. I'll come back in 6 months only if you can prove that I don't have cancer now. If you tell me, no, you don't have cancer, this is negative, this is negative, this is negative, and you explain me, okay, I'm going to keep an eye on it. And no, I'm not going to come back in 6 months, I might come back in 3. And if nothing happens, great. You're on the right track. Might have been something else. But it is so important that it can get to the point where there's no turning back. That's the problem. If that uprising creates a big lump, and that lump creates a problem systemically, and worse, spreads to other organs of the body, that's going to be expensive, painful, and questionably successful. So I don't want to get to that part, doctor. Please understand me. This is, again, part of what began as a 3-part series of understanding cancer, that now it's going to be 5. Because every time we face cancer, many of us might not have a clear idea of what we're talking about. So I would ask you, I would beg you to follow the links and contact and review all these important podcasts. And if you have any questions or comments, you can always call me or ask me through the social media of your choice. I'm in all of them. So you can ask a question, you can have a comment, you can say, I don't agree, you can, anything you want. I'll be very happy to back you up. Let me go to some very important problems. One of them, which again could become deadly if we don't do anything, it's ovarian cancer. Ovarian cancer is one of those things that give symptoms that are very vague, that could be anything, could be something you ate, because there's a feeling of fullness, of pain in your lower abdomen, a little bit of pain, girth. You feel like something doesn't fit, and it could be also bleeding, vaginal bleeding. Any of those symptoms could be anything. Could be colitis, which is what it is confounded with most frequently. But if you're above 40 years old and you have any of these symptoms, a simple ultrasound will tell you if there's anything there. Also, there are tumor markers that can be tested in the blood without any problem. You take a blood sample, you do an ultrasound, and you say, everything is fine. Whew. Big sigh of relief. But if something is happening, you want to know immediately, because early treatment can give you a lot of success. What else? Lung cancer. Lung cancer is also very frequent. And there's something very important. The CDC tells us that there's really no need for a lot of testing to follow up on cancer unless three main things. One, you're a smoker. Second, you are a second-hand smoker. I have seen cancer patients on spouses of a smoker. The smoker lived happily ever after. The wife or the husband died of lung cancer. It's unfair, but it's true. Don't let anybody smoke around you. Period. It's absolutely true. Second-hand smoke kills. So don't allow it. It's your right. It's your health. It's your life. So ban out of your environment anybody that smokes. And third, which I don't find what we can do with it, is pollution. Pollution, if you live in a polluted area, if you work in a polluted environment and so forth, yes, there you can do a check. Once again, we have a very high-tech tool. That's probably the most accurate way to tell that you're absolutely normal, which is what's called a low-dose computer tomography. It's a simple procedure. It's completely painless. It's completely simple. You can do it once a year if you're a smoker, and or you're in the high-risk situation, and will help you to tell in a very accurate way. Okay, so that is a good way to tell. But if you're a non-smoker, if you live in a clean environment and so forth, I would still say you could do this type of tomography every 5 years, every 3 years if you have any concern. Be aware also if genetically people in your blood family have cancer. That might be a clue. You might have an internal mutation that could favor cancer development. In that case, make sure you double your effort. Make sure you double your surveillance. And last but not least, colon cancer. I'm going to talk about colon cancer because once again, it's a cancer that can be successfully be defeated from the beginning. That is the most important part. That's a cancer that you can nip in the bud. You can get rid of it in the beginning. Many of the cancers that are deadly that I'm mentioning, they can be nipped in the bud. If we only know. It's like, I have a problem in my garden. I have a huge, beautiful tree that drops seeds all over, and then all of a sudden I have all these trees that if I let them, they're going to create a forest. So I have to be, I don't want to just pull them off. I have to put them in pots and beg to people to adopt them in parks and so forth, because they're huge trees, beautiful trees. It's the same thing here. If you can get the cancer when it's just a small group of cells, you're going to be successful. And colon cancer can, just like bladder cancer, can give you blood in the stool very early. And it's a simple $5 test to do it. But now we have other techniques. You can take the stool sample, send it to the lab, and not only you can tell if there is blood, but you can tell if there are any immunochemical substances connected to colonic cancer. And furthermore, you can do this fecal immunochemical test with a DNA test, because cancer cells produce an abnormal DNA that can be read and detected in the laboratory. So you can ask your doctor, and you have seen it on TV. You poop, you ship, you get your result. It's very simple. It's a simple thing to do, inexpensive. You have no suffering. It's not invasive. It doesn't going to do a big thing, and you can do it once a year. Even if you don't have anything, I would absolutely advise you to do it once a year. And you can go again around your birthday and get all these things done. That's going to be a good beginning. But don't forget that we have a team of doctors at BioCare Hospital ready to answer your questions, ready to listen to your comments, ready to advise you, guide you to things that you could do, to things that you could discuss with your doctor, to things that you should request. And we have all the tools that I have mentioned. If you decided to have a thorough checkup at BioCare, in which at the same time you could be doing rejuvenation and restoration treatment plan. Follow me, stay with me, share all of this. Very important.